Hello and welcome to my BMS 263 Assessment 2. So we'll start with some key information from the case study. So our client has been diagnosed with type 1 diabetes, rheumatoid arthritis and so on, and here's the dates related to them. We also have the medication that she's taking for these, the strength of the medication, the dosage, and when they last had a script for these. Today we'll be focusing on type 1 diabetes. So type 1 diabetes is an autoimmune disease affecting the production of insulin in the pancreas as the body's immune system destroys beta cells. Type 1 diabetes also causes a change in the individual's DNA methylation, histone modification, and miRNA modification, altering their gene expression away from the normal range. Type 1 diabetes comorbidities. So type 1 diabetes has multiple comorbidities linked with our patient, Monique Laurent. These include rheumatoid arthritis, coronary artery disease, and myocardial infarction. Rheumatoid arthritis is a chronic illness affecting the body's joints by causing damage to the cartilage at the end of the affected bones, which causes inflammation. Our patient was diagnosed with type 1 diabetes in 2002, which would have hindered the ability of her pancreas to produce insulin as the body's immune system attacks the cells within the pancreas. Similarly, rheumatoid arthritis is an autoimmune disease where the body's immune system attacks the body's healthy tissue. This indicates that the body's gene predisposition is out of the normal range, causing the immune system to attack healthy cells and tissue. Rheumatoid arthritis causes inflammation around the joints, and inflammation promotes insulin resistance. Rheumatoid arthritis also reduces glucagon production within the whole body. The relationship between type 1 diabetes and rheumatoid arthritis has a negative effect on the body's ability to produce and regulate insulin, as well as the body's ability to regulate blood sugar levels. Nurofen is a brand name for the drug ibuprofen. Ibuprofen is a non-steroidal anti-inflammatory drug taken by individuals to decrease swelling and pain. Nurofen would be beneficial for type 1 diabetes by reducing swelling around the body and a reduction in pain within these areas. However, it has potential to be harmful on plasma glucose levels. Nurofen affects ion channel function in the pancreatic beta cells. As these cells are already being attacked due to type 1 diabetes, the effect of Nurofen will alter their ability further to secrete insulin, enhancing the body's struggle to sufficiently secrete insulin and regulate blood glucose levels. This will affect the pharmacodynamics involved. So Humalog and prednisone. Humalog is a brand name for an insulin lispro rapid-acting analog. To use Humalog, you must inject insulin into the body. The insulin is rapidly absorbed by the body from the subcutaneous injection site. Injection as an administration aids the ability to swiftly absorb the insulin into circulation. This results in Humalog being a short-acting insulin source compared to the regular insulin. Being a shorter-acting source of insulin decreases the risk of hypoglycemia after eating a meal, which is common for type 1 diabetics. The liver and kidneys are the primary organs used for the degradation of insulin. Sometimes the area where Humalog is injected can present a rash or swelling, otherwise there are no unwanted effects. Prednisone is a synthetic glucocorticoid drug used to reduce inflammation and suppress the immune system. It is a delayed-release corticosteroid, meaning once administered, the effects won't occur until a few hours later. Prednisone is administered orally from a form of tablet, whereas it is digested in the stomach and intestines and then absorbed into the bloodstream. It decreases inflammation by suppressing the movement of polymorphonuclear leukocytes, which are phagocytes that destroy microorganisms. It also increases capillary permeability, which allows for more fluid to flow out of the inflamed area. There are many adverse effects that are caused by prednisone. These include hypoglycemia, hypertension, osteoporosis, and more. Drug-drug interactions between the two. When taking the two drugs together, there is a change in efficacy of them. As stated previously, prednisone has a risk of causing hypoglycemia. This is because the insulin's action is blocked as glucocorticoid drugs promote glucogenesis in the liver. This implies that the degradation of insulin cannot occur. As prednisone increases the chances of hypoglycemia, Humalog's efficacy is decreased. Without the insulin being degraded, the body cannot control blood sugar levels as it cannot move glucose out of the bloodstream into cells. So taking prednisone with Humalog all but cancels out the efficacy of Humalog unless the dose is increased. Within the drug-drug interaction, only Humalog is affected by prednisone. Insulin lispro drugs, such as Humalog, have no effect on the efficacy of prednisone. The absorption of insulin injected through Humalog cannot occur as prednisone promotes gluconeogenesis, which opposes the effects of insulin. Due to this, the mechanism of action for Humalog is negatively affected. As the insulin cannot be degraded, the glucose produced by the liver cannot be transported into your cells, meaning it builds up in your bloodstream, causing hypoglycemia. How are these drugs linked to our client's condition? So the drug-drug interaction between Humalog and prednisone are prescribed for type 1 diabetes and rheumatoid arthritis. Humalog is linked to type 1 diabetes as it is an insulin lispro used to regulate blood sugar levels and aiming to avoid hypoglycemia, which is caused by diabetes. Humalog will inject insulin into the body with an equal efficacy to natural human insulin. This provides the body with necessary insulin levels it needs to regulate the blood sugar levels, and it is often injected after meals as that is when blood sugar levels increase. Prednisone is a synthetic glucocorticoid drug used to reduce inflammation and suppress the immune system. It works by suppressing the movement of polymorphonuclear leukocytes and increasing capillary permeability. Prednisone is used to treat a variety of health issues. In relation to the case study, it would treat rheumatoid arthritis and for short periods of time the inflammation caused by COPD. It would also be taken to suppress the harmful cytokines which cause inflammation, hence reducing inflammation around the joints affected. It also targets cyclooxygenase 2, which is an enzyme responsible for pain and inflammation, hence reducing the inflammation and pain around the affected area. So the type of drug-drug interaction, the information that ChatGPT has stated about the drug-drug interaction between Humalog and prednisone is correct. Prednisone does negatively affect the ability for insulin to be absorbed, as stated previously. Adjusting the dose of insulin does have the ability to increase the efficacy of Humalog. The name given to the drug-drug interaction between the two would be an antagonist pharmacodynamic interaction. The interaction is antagonist pharmacodynamic as the insulin's efficacy is decreased at the liver, where it is meant to be degraded and released into the bloodstream. The insulin is not degraded at the liver as prednisone promotes gluconeogenesis, which opposes the degradation of insulin. This negatively affects the pharmacodynamics of Humalog, as prednisone does not allow for the insulin to be released. This displays an antagonist relationship as the prednisone opposes the effects of Humalog. The drug-drug interaction between Humalog and prednisone is not positive for our client. Humalog has been prescribed to help regulate her blood sugar levels and avoid hypoglycemia. However, prednisone reduces the efficacy of Humalog as it blocks the action of insulin, not allowing for glucose to be transported from the blood to the cells. This places our client at a higher risk of hypoglycemia, as interaction between the two drugs can present unpredictable blood sugar levels. Our client will have to regularly check their blood sugar. The negative effect of the drug-drug can be reduced if the dose of insulin is raised. How will this information benefit my career? As a future physiotherapist, it is extremely important to have the ability to understand drug-drug interactions and how they alter their body's normal functions. Type 1 diabetes is a very common autoimmune disease. As it is so common, many of my future patients will most likely have it. Having knowledge of the way this disease alters their body away from the norms is important, including their body's functionality and cellular change. It is also important to understand what medication they are taking and how this could affect their injury and recovery. Knowing what their medication does to the body is important when diagnosing injury and just as important when pushing recovery. Physiotherapists can also help type 1 diabetics manage their health by creating a sufficient exercise plan to improve physical health overall without risking further damage to the patient. In relation to the interaction, an individual with diabetes taking Humalog and prednisone has to be aware of their blood glucose levels. When recommending physical activity, it would be important to start with a small dose of exercise to ensure that there are multiple breaks, and ensure that there are multiple breaks between exercises so that they can check and replenish their blood sugar levels if needed. And these are the references. Thank you.